Guys, we are going to see how does the mental health affect our physical health. So although the mind and bodies are often viewed as being separate, mental and physical health are actually closely related. Mostly people don't know it. So good mental health can positively affect your physical health. In return, poor mental health can negatively affect your physical health. So what are the effects of the mental health on the physical health? Your mental health plays a huge role in your general well-being. Being in a good mental health can keep you healthy and help prevent serious health issues. A study found that a positive psychological well being can reduce the risk of heart attack and strokes. On the other hand, poor mental health can lead to a poor physical health or harmful behavior. Chronic diseases. Depression has been linked to many chronic diseases or many chronic illness. These illnesses include the diabetes, asthma, cancer, cardiovascular disease, and the arthritis. So, mental health conditions can also make dealing with the chronic illness more difficult. The mortality rate from cancer and heart disease is higher among people with depression or other mental health conditions. Sleep problems. People with the mental health conditions are most likely to suffer from the sleep disorders like insomnia or the sleep apnea. Insomnia can make it hard to fall asleep or stay asleep. So, sleep apnea leads to breathing problems, which can cause you wake up frequently. Around 50 to 80% of people with mental health conditions will also have sleeping problem. Only 10 to 18% of the general population experiences sleeping problem. While conditions like depression and anxiety or bipolar disorder may lead to sleep problems can also make existing mental health conditions worse. Smoking. People with health conditions are most likely to smoke than those who do not have mental health conditions. Among smokers, people with mental health conditions are most likely to smoke greater number of cigarettes. People with the depression have lower levels of the chemical dopamine. Dopamine. So dopamine influences positive feeling in your brain. The nicotine in cigarette triggers the production of the chemical dopamine. So smoking may be used as a way to relieve symptoms of the depression. However, since nicotine only offers temporary relief, you may feel a recurring need to smoke, which lead to a possible addiction. So, access to healthcare. People with the mental health conditions are less likely to have the access to adequate healthcare. It may also be more difficult for the people with mental health condition to take care of their physical health. When you have a mental health conditions, it can be hard to seek care, take prescriptions regularly, or get enough exercise. So, what the research shows is that mental illness may be linked to the premature aging in different ways. Like they can lead to unhealthy behavior like poor diet or lack of exercise and substances use that are bad for their physical health and many bad health conditions and the stress they can cause the disrupt sleep which can harm physical health over time. So stress can also chronically elevated level of the cortisol which can disrupt just about every bodily function including the digestive system, immune system, cardiovascular system and even reproductive system. So for the people with mental illness, this can put them at the risk for the range of the medical conditions including high blood pressure, BB, BB problems, heart disease, diabetes, stroke, and cancer. So, what are the tips for maintaining mental and physical health? There is a silver lining to all the research on the interactions between mental and physical health. Make regular exercise a lifelong habit. Don't overdo it. Aim for 15 to 30 minutes or moderate per week. Pick the activities you really enjoy or start with ridiculously small goals.